Dr. Seheult, the Johnson & Johnson vaccine and blood clots, that's the big news story of the day, and the FDA and CDC has temporarily paused the administration of that vaccine in the United States. Can you give us an overview of what's going on? And then I want to get to a lot of questions about details on what this means for people who have already had the Johnson & Johnson vaccine, people who are planning on getting that vaccine, and would also love for you to illustrate what's going on with this particular type of blood clot at the anatomical level. But to start, could you just give us an update on what's going on with this news story?
Yes, thanks, Kyle. So as you know, the Johnson & Johnson vaccine was the third vaccine in the United States to get emergency use authorization. That was given at the end of February, beginning of March. Since that time, about 6.8 million doses have been given in the United States. And during that time, there is a reporting system called the VAERS, where they've been keeping track of adverse reactions. And during this time, there have been about 6 patients that have developed something called Cerebral Venous Sinus Thrombosis, or CVST for short. And in the FDA's review of those 6 individuals, all of whom are women between the age of 18 and 48, who developed these complications between 6 and 13 days post-vaccination. One of them has died, the other one is in critical condition. And because of that, the FDA has put the vaccination campaign on pause, has not mandated that vaccination stop with the Johnson & Johnson vaccine. But because of the serious nature of these thromboses, they wanted to investigate that. But I think what we need to do is talk a little bit more about exactly what CVST is. And so I think instead of talking about it, I'd rather illustrate it for you.
So we know that blood has to go to the brain, and that actually comes through the carotid artery right here. And it goes up and it splits off, and we won't get into the anatomy of that. But the point is that the blood from the body goes to the brain and supplies the neurons and the brain with oxygenated blood. After that happens, the blood then collects into this system that you see here in blue. And depending on what part of the brain we're talking about, there's different venous structures. And so these are known as sinuses because they don't have the typical musculature, albeit rudimentary, that you would see in normal veins. And so we have different types of venous structures, all of which drain blood back to a central location. And you can see that here as the blood flows back, it flows down and then back eventually to the heart. So eventually it's going to end up here in one of 2 internal jugular veins. We have the sigmoid sinus here, we have the occipital sinus, the transverse sinus, the straight sinus, and at the top here we have the superior sagittal sinus. So what can happen is you can get a clot that forms, and if you have a clot that forms, it's going to cause an obstruction to flow, and you will start to see enlargement and an increase in back pressure in these venous structures. And those will then cause back pressure on that part of the brain that is being drained by these veins. So let's talk about the symptoms. One of the biggest symptoms, and of course it's not very specific, is a headache. Another possible symptom is abnormal vision. Symptoms of a stroke. So this would be where one side of the body is not working as well as the other. That could happen on the face or in the limbs or even in the legs. And then finally, seizures. Now again, this is happening because there has been a thrombosis or a clot that is formed in any one of these sinuses or veins. Other important factors that you should know is that it's much more common in females than it is in males, almost a 3-to-1 ratio. It's also more common in obesity and in a younger patient. Think about this type of diagnosis. Because you're trying to find a very delicate area and you're trying to detect whether or not there is an increase in pressure in size before the thrombosis, the best way to make the diagnosis is with a MRI and something called an MRV, V standing for vein, which is in the name, CVST. So MRI, MRV, if there is concerns.
That was really helpful to visualize what cerebral venous sinus thrombosis is. But does that condition cover exactly what's going on here with this potential thrombosis from the Johnson & Johnson vaccine? And how does this type of blood clot or thrombosis compare with what we've seen with the AstraZeneca vaccine?
Those are very good questions. So if we go back to the numbers, Kyle, there have been over 6.8 million doses given here in the United States. And despite that very high number, that represents less than 5% of the total number of doses that have been given out here in the United States. And with the 6 cases that we're looking at here, that's about a 1 in a million shot at getting this complication. So one might ask, well, why are they making a big deal out of something that's just 1 in a million? And it boils down to the first question that you ask: how is this different? It's different in the sense that there is something more than just a thrombosis. There is low platelets. And that is a concern about how this condition would be treated, especially if more cases came up. What they are thinking here, what they are understanding, is that there may be a situation where antibodies are being made against the platelets and also something called a platelet factor 4, which causes the platelets to drop out of circulation and at the same time activate what the platelets release, causing a prothrombotic event. For those that are in the medical field, they might recognize this as something very similar to what we call heparin-induced thrombocytopenia syndrome. This is where even though the platelets, which are responsible for coagulation and the initiation of coagulation, even though they are low, you would think that that would cause more bleeding. In fact, it causes the opposite. It causes thrombosis not only in the venous system, but also in the arterial system. And if you do see this type of a situation, what is important to understand from a medical care standpoint is that the use of heparin in these types of situations is actually contraindicated and could make things worse. So if you are seeing clots as a healthcare provider, especially after someone has been vaccinated with the Johnson & Johnson vaccine, the reason why they wanted to discuss this and they got this out there was to make sure that not to use heparin products. Now, you asked about how this might be similar or different to the AstraZeneca Oxford vaccination that is not approved in this country. It's not given emergency use authorization, but currently is being used in Europe, where it is being investigated also for blood clots as well. In fact, there was a paper that was just recently published in the New England Journal of Medicine asking this very question and reviewing a number of cases. And they also seem to see a situation where antibodies are being formed against platelets and this platelet factor 4, which is causing a prothrombotic state and also low platelets as well. And again, they are advocating in that paper as well as here in the United States that if we see those type of cases, as we would do in heparin-induced thrombocytopenia, not to use heparin products, but rather other anticoagulants, in addition to, by the way, something called IVIG, or intravenous immunoglobulin. This is an antibody that binds these antibodies that are being made so that they cannot produce the type of negative effects. Again, this is a 1 in a million shot. This is a very rare side effect that they are seeing, but they're seeing it both potentially in AstraZeneca in Europe and here with the Johnson & Johnson vaccine in the United States. And we'll talk a little bit more about what these numbers really mean. But I think the key point here is they wanted to be out of an abundance of caution, even though this is 6 cases out of 6+ million doses. They wanted to make sure that healthcare workers were understanding of this, aware of this, so that they could be looked at and they could be surveyed and treat them appropriately.
You mentioned that the FDA and CDC made this decision about the Johnson & Johnson vaccine out of an abundance of caution. That was certainly one of the talking points for public health officials today. I put together a slide that shows some of the relative risk of a blood clot potentially from the Johnson & Johnson vaccine versus other things, and was wondering if you could walk us through that.
Yeah, so cerebral venous sinus thrombosis is not something that is new. It's been around. It can happen. As we talked about, it tends to happen more in women than in men. But if you were to look at the general population, what would be the chances of somebody coming down with a case of CVST? And if you look at this, the general population is about 0.5 per 100,000 per year. Actually, if you were to come down with COVID-19, the relative risk there is 4.5 to 20 per 100,000 cases of COVID-19. Obviously, in women who are pregnant, there is a hypercoagulable state associated with that. And again, we see about 10 to 12 per 100,000 deliveries can develop CVST. Oral contraceptives are well known to cause a hypercoagulable state, and we can see a wide range of increased risk there at 2.7 to 40 people per 100,000. And so what we're looking at here when we're talking about 6.8 million doses given and 6 individuals coming down with cerebral venous sinus thrombosis, we're looking at potentially 0.09 people per 100,000 vaccines given. You're looking at about 1 in a million. You know, another way of looking at this, Kyle, is about 115 million people every day get into automobiles and travel. And of those 115 million people, 16,000 of them get into some sort of a car accident or fender bender. And unfortunately, every single day, 100 people die in automobile accidents. So if you look at those numbers, that's also about a 1 in a million chance, maybe slightly less. Very similar to the chances that we're talking about here with the Johnson & Johnson vaccine.
So you mentioned the VAERS, or Vaccine Adverse Event Reporting System. Can you explain more about what that is and some of the misunderstandings about this reporting system?
Yeah, so basically it's a clearinghouse where anybody can put in information about what may have happened after a vaccine was given. And it's a clearinghouse and it's a repository of information so that scientists and vaccine experts can look over this and see whether or not there is a signal that shows that above the population level, above the baseline level that we would normally see, there is a problem that needs to be investigated. You know, look, if you were to follow 100,000 people for a year, just at random, 100,000 people for a year, at the end of that year, Kyle, 700 people would be dead in that cohort. And that's just based on all-cause mortality. That happens to be the all-cause mortality here in the United States. And so anytime you take a population and follow it, things are going to happen. People are going to get sick, and people are going to die. And so the question is when these things get fed into the system, when you look up on the VAERS and you see that there are certain adverse reactions, things that have happened, the assumption is to think, at least initially, that these are all the things that have happened as a result, as a cause of getting, or as a result of getting the vaccine, when that's not necessarily the case. It's associated in these same individuals. But then the hard work of understanding statistics and epidemiology to figure out whether or not there is a higher than normal frequency of these events starts, and that's where they are right now, looking at these adverse reactions.
So a big question that's out there right now is people who have already had the Johnson & Johnson vaccine. Is there anything in particular they should be doing or looking out for? And also people that were scheduled or planning on getting the Johnson & Johnson vaccine, what should they be doing right now?
Yeah, well, first of all, if you're scheduled to get the Johnson & Johnson vaccine, in a number of cases, they've already switched those out to either the Pfizer-BioNTech vaccine or the Moderna vaccine. If they haven't, they've already probably notified you. And we anticipate that this pause in the campaign for vaccination by the federal government is going to be paused for a couple of days, and we'll hear more information very soon about where that's going to go. Now, if you've already gotten the vaccine, the Johnson & Johnson vaccine, and it's been less than 2 or 3 weeks since you've gotten it. If it's been more than 2 to 3 weeks, then you probably have nothing to worry about, because these things all popped up within 2 weeks of vaccination. And when I say worry, again, it's a 1 in a million shot, it seems, but it's always wise to look out for some of the signs of this type of complication. And what would that be? A CVST, or a cerebral venous thrombosis. would be the kind of things that you would be interested in looking at is headaches that are continuous, constant, double vision, weakness on one side of the face or the other, or even in the arms or legs, or even seizures, as we've talked about before. So these are warning signs to go and seek medical attention in the emergency room if that's happening. And of course, let the providers there in the emergency room know that you are a recipient of the Johnson & Johnson vaccine.
So far, you've really focused on the blood clots that can happen in the brain, but can clotting from this condition happen other places in the body as well?
Absolutely. It's interesting to me that that almost all of these cases focused on the cerebral venous sinus thrombosis. But absolutely, Kyle, you can get blood clots in the lungs. You can get blood clots in the organs of the abdomen. You can get blood clots in the legs. All of those, of course, have different symptoms. Let's start with the lungs first. It would be a sensation of sudden shortness of breath and what we call shortness of breath on exertion. The other symptoms could be abdominal pain, epigastric, that would be sort of above your belly button, continuous abdominal pain there. If it was in your legs, then you would have pain in your legs, either on one side or on both, if there was clots on both sides of your legs. And you might even see swelling, particularly at the end of the day when you're walking around. So these are all danger signs that you need to go to the hospital and be checked out in the emergency room, and of course let them know about your vaccination history.
We know that all 6 cases have happened in women from the age 18 to 48. Why do you think that's the case?
That's a very good question. We don't know what their use is of oral contraceptive medication. I know they're investigating that. That would be an added risk factor in terms of thrombosis. But if you look at this 2 different ways, if this is an immune-related thrombosis, or if it is a hypercoagulable related thrombosis, in both of those situations, women typically are at higher risk. You know, women's immune systems are generally more robust than men's. This is the reason why men had a more difficult time with COVID-19 in the hospital in terms of mortality and morbidity over women. And in this situation, women are more likely to get antibodies, autoimmune conditions. We see that disparity in all sorts of autoimmune conditions such as lupus, rheumatoid arthritis, and other autoimmune conditions. So it's certainly possible that that is what we're seeing. There is some data out of Europe that is looking at the AstraZeneca vaccine and the thromboses there. They also are seeing a predominance in female over male, and also younger as well. And again, there is the specter that is raised of a autoimmune situation. So I think that's primarily the 2 reasons why I would say that we are seeing women represented disproportionately here in these complications.
In the news cycle today, public health officials in the U.S. were very quick to point out that there has been no increased safety signal in the mRNA vaccines. Do you agree with that? Do you think that people should proceed as normal with the mRNA vaccines at this time?
Yeah, absolutely. Even though there is only a 1 in a million chance so far based on these results of getting CVST, we have an alternative that hasn't shown that signal in any way, shape, or form, and that's the Pfizer-BioNTech and the Moderna vaccines. There is some interesting data that's looking at why that might be the case. The 2 vaccines that have shown a potential increase in blood clots is the AstraZeneca Oxford vaccine and, of course, the Johnson & Johnson. Both of those use an adenovirus vector to get the DNA into the cells to make the spike protein. As you know, the Pfizer-BioNTech and Moderna vaccines don't use the adenovirus at all. They use lipid droplets to get the messenger RNA into the cells to produce the spike protein. And again, we have not seen any sort of increased risk of blood clots, and they're not under any kind of investigation for this. And so, yes, absolutely. If people are interested in getting a vaccine and they have been concerned about this development, I would definitely direct them over to the remaining 2 vaccines that are currently available in this country.
Of course, this decision that the CDC and the FDA made to pause the Johnson & Johnson vaccine temporarily has been controversial. There's been strong arguments on both sides. A well-known economist and statistician named Nate Silver has been very critical of this decision from a pure stats and numbers standpoint. And then public health officials and scientists on the other side are saying, absolutely, this is the right call. When you get a safety signal like this, it's really important to investigate it, and it helps build public confidence in the vaccine process. So, of course, vaccine hesitancy is a potential problem in the United States right now. What's your opinion on all this? Do you think the FDA and CDC made the right call? Do you think this will make vaccine hesitancy potentially worse?
Yeah, it's a very good question, and I struggle with this. I guess we'll find out for sure, depending on how things go. But I can certainly see somebody at home thinking, should I get the vaccine? Should I not get the vaccine? And then this news comes out that's kind of spooky, and you say, you know what, I'm going to hold off at this point because I don't know what's going on, and I don't know. And therefore, that could be obviously a bad thing, a negative thing if you're trying to get people vaccinated. Of course, there's the other side of it where people are like, I don't really trust the FDA. I don't know if they're doing what they need to be doing, if they're not watching this very carefully. And certainly after today, with just, a 1 in a million chance potentially, obviously 6 people who get CVST is 6 people too many. But obviously things happen, and when you're vaccinating hundreds of millions of people, these sorts of things pop up. And to know that the FDA is monitoring this and they're willing to actually put a stop to an active vaccine campaign, and I'll just clarify there that they haven't mandated that everybody stop. A physician and a patient, if they choose to get a Johnson & Johnson vaccine, can still do that. But in terms of federally operated vaccine campaigns, they have stopped using the Johnson & Johnson, at least temporarily here. To think that they're actually willing to do that based on a small signal such as this could lead some confidence to people that, yes, the people at the top are monitoring things and looking at this. And that's purely from a PR standpoint. I mean, from a medical scientific standpoint, it's absolutely the right thing to do if you want to make sure that you're not harming people unnecessarily. It's an interesting thing, Kyle, because right now in this country, if we had nothing else, if we just had one vaccine, the Johnson & Johnson vaccine, it would be a much more difficult decision to do. But we have choices at this point. We have 3 different choices to choose from. And if one of these things does increase the risk unnecessarily, then we can always fall back on the other 2. And I'm happy to say, and I've seen some differences in this, but I'm happy to say from what I've read, it seems as though there is enough supply and there's enough room there for Pfizer-BioNTech and Moderna to increase their supply to take up the difference. Again, less than 5% of the vaccines currently in this country that have been delivered into arms is from Johnson & Johnson.
For someone watching this who may be on the fence about getting vaccinated, and then they see this news about the Johnson & Johnson vaccine, and they maybe decide, well, I probably won't get it at this point. What information would you share with them about where we are in the pandemic and the risks of COVID-19 at this time?
Yeah, so we've had increasing cases in places like Michigan, New York, Pennsylvania, Florida, and we're on a race, basically a race to suppress the current wave of infections here in the United States. Obviously, there are countries around the world that have it much worse than we do, such as Brazil, and now emerging as India. And so long as there are places in the world, we're never going to be safe. And so my recommendation is to get vaccinated if you're able to do so. And if you look at the recent data, Kyle, that was published on the CDC website just about a week ago, it showed that the Pfizer-BioNTech and the Moderna vaccines were 80% effective at preventing infection after the first dose. And after the second dose, that went up to 90%. So that was a real world example in terms of efficacy at preventing asymptomatic transmission of the virus. And if there's one thing that will shut down a pandemic real fast, it's if that virus can't spread to somebody else.
So to clarify, do you still think the best path back to avoiding lockdowns, getting back to large gatherings of people and moving to a better place with this pandemic is vaccination at this time?
Well, so basically there are things that we can do for ourselves and that there are things that we can do for other people. The things that we do for ourselves is to make sure that our immune system is the strongest that it can possibly be. And we've talked about that in terms of sleep, in terms of supplements, in terms of making sure that you've got good nutrition and all of those things. And that's part and parcel about what we need to do for our own bodies, because the vaccine will take care of this pandemic, but we want to also make sure that our bodies are strong. But in terms of those people that can't get the vaccine, or for those of us that even though our bodies are in great shape and we're doing very well, we will only know if we've transmitted the virus after the fact. And so there's asymptomatic spread. And so the way to reduce that is vaccination, but also testing if that's available, and also distancing and mask wearing. So these are all things that we can do here in this emergency situation to cut down and cut down on the spread of the virus. Kyle, just to finish up on that point, if you look at what's going on in Michigan, where they've done a very good job at vaccinating the older population, now what they're starting to see with this recent outbreak, 50% of the patients are under the age of 50, many of them without comorbidities. So you can be as healthy as you want to be, but still there is a chance that COVID-19 might not kill you, but it could give you long-term COVID symptoms, loss of smell, loss of taste, and those sorts of things. So there is benefit all the way around.
Well, Dr. Seheult, thank you as always for explaining this important event and illustrating it. And we'll see you soon for another update, I'm sure.
Thanks, Kyle.